Welcome back. We have a number of questions from viewers tonight. Our first question comes from Tracy Edmonds in Observatory Hill.
My question for the panelists, do you expect that we will have to be vaccinated annually like the flu shot?
And Dr. Johnson, Moore, I think that is a very common question. Will we have to get vaccinated every year like the flu shot?
Well, then at this time, we don't really know the answer to that question, but here's what we know. We know that there are two types of immunity following infection. The first is natural immunity, what the body produces after it's exposed to infection. Those are your antibodies and your cellular memory. And then there's vaccine immunity. That's the antibodies that our body produces after we get a vaccine. Now, we know that after people get COVID-19 infection, they will produce antibodies if they recover. How long these antibodies will last, we don't really know yet. They may last 6 months, they may last up to a year. As far as the antibody, the immune response produced after the COVID-19 vaccines, scientists are measuring this. They're following people in the clinical trials. We know that vaccine immunity will probably last 6 to 9 months. After that, we really don't know. That's one of the questions we don't know right now. But we do have experience with other vaccines. So for example, there's long-lasting immunity after the measles, mumps, and rubella. You get 2 shots, your 2 MMRs, you're probably immune for the rest of your life. The diphtheria, pertussis, tetanus shot, for example, that's an example where there's intermediate immunity. You have to get a booster shot, a tetanus booster, every 10 years. Now the flu shot, that's the other extreme. There's really no cumulative immunity to the flu vaccine, and the virus changes. So there's 2 components of this. There's the immunity component, and then there's what's called the antigenic drift, the mutations of this virus. We know right now this virus has a lot of mutations. These are called variants. So what the scientists are doing are watching these variants to really see what's going to happen. So it may be such that we have to get a booster vaccine because the virus is changing so much. Time will tell.
And time will tell. And Dr. Craig Beyer, very quickly, I know you spend a lot of time in the geriatric field, and so I wonder, with our older patients, if you will, is that one of the concerns that they have, that there's just so much that we don't know when we talk about time will tell?
Thank you for having me, Lynn, and it's wonderful to be here among these very respected health professionals. I do have to correct one real quick question, that I am from the School of Nursing, not the School of Medicine.
Oh, I'm sorry.
And having that background and having it as one of my favorite populations is geriatric, yes, the answer is to that question from the nurse's point of view. We would like our folks to get ready for understanding, as Dr. Johnson had said, that this is going to be another part of the pandemic. This is going to be another part of the parameters of what we have to do every year to keep ourselves safe. So that we need to just automatically right now start thinking about, this is one more added shot that we may have to think about at a certain particular time of the year. When we do find out what the biological consequences are, we want to say to all of our folks that our job is to make sure that you know that it's going to be like this, that we can deal with it really well if we're very mindful of that in the very beginning.
So one thing is for sure, we talk to each other about things like the vaccine, like the virus. We talk to each other, whether it's socially, whether it's at the barbershop or at a nail salon. Nail salon in KDKA's Royce Jones spent some time going to a couple of spots to see what people were talking about.
But I got one of them letters that they'll pay me $750 to come take the vaccine.
Really?
I just ripped it up, put it through the trash.
The sound of conversation
And hair clippers buzz inside Chris Styles, a black-owned barbershop on Penn Avenue in Wilkinsburg. From Smack Talk.
We got a Cleveland guy here. Okay. Yeah, he gets most of the heat around here.
To Real Talk.
I haven't seen your mom lately.
Customers have been leaving the chair with a clean cut and a clear head since 2005.
You never know how a person feels when they come in here or what they're going through.
But today, those discussions look and sound much different. The big barbershop debate these days, the coronavirus vaccine.
They come in talking about they don't want to be the test dummy.
Instead of making reservations, many of the people here are having them, like shop manager George Daniels, a type 2 diabetic with a demand for more data.
If I go down there and take that shot and my health goes left, then yeah, I'm in trouble. Because next, I don't have no health coverage as of right now. So yeah, it's very, I have to think before I do.
That's messed up.
That is messed up.
That's messed up.
Meanwhile, the vibe inside Ambiance Hair and Nail Gallery on the north side is also one of nervous energy.
So now when you see people cough or when you see people sneeze, it's no longer a bless you or are you okay? It's like, oh, are you okay? You know, are you sick?
Nervous about getting the virus.
If you say you had a coronavirus, oh, well, maybe I'll see you next year. You know what I mean?
And the vaccine.
I got the swine flu shot in '76, and I reacted. I actually passed out after having the shot. So I'm a little afraid because of my system.
And while some have personal reasons, many also have bad blood over the historical ones, like the Tuskegee study, which has left the black community unsettled for generations.
We have to really come to the realization that we feel like test dummies. We feel like anything that you want to see if people die from, you come right to us. And we're tired of feeling that way.
It did cause a lot of mistrust among African Americans in this country. You know, we learned that we're not treated the same. So why is it different now?
With all this distrust, what will it take to make people in the black community believe in the science of the coronavirus vaccine? Some say it's as simple as transparency.
Just information, because with information you get the knowledge. And when you have that knowledge, you can make a sound decision from that.
Others hope for better representation and more people of color in the medical field.
So that we can actually be able to go back to our communities and be like, hey, like the data's here, let me show you the data, this is working for us right here. There's not a lot of us when we go to the doctors.
To the world, this needle represents hope and the upending of the coronavirus pandemic. To many in the black community, a reminder years of wrongdoing desperately needs undoing. Only then can true healing happen. I'm Royce Jones, KDKA News.
So what if you don't have health insurance? We'll talk about that coming up. Virus to vaccine, COVID-19 in the black community continues.